Hello students, today is March 21st, 2018 and this audio video recording of maternity math is to substitute for our snow day because you all were supposed to have lab today but it didn't happen, and one section of the lab was maternity math. This has not many slides, only 12 slides. Um, Now, maternity math, we do it separately from the other kinds of math is because of the drugs involved. And one of the drugs involved is oxytocin or pitocin. And oxytocin is a hormone which is made by hypothalamus, and it is stored and released by the posterior part of the pituitary gland in our brain. So when oxytocin is released, it produces a feeling of love, satisfaction, and it's also affects certain organs in our body. And for the purpose of this course, it affects uterus and the breast. Uh, Now, this chemical communicates with the reproductive system during the childbirth. Of course, when mom is kind of nursing the baby, during lactation and during certain human behaviors. Now, this hormone is also in men, and it affects men's testosterone production and also the movement of their sperms. So another name for oxytocin in layman world, for the outside world, is love hormone, but we are not concerned with that right now. We are concerned about with the fact that what does it do to the uterus, and also, uh, you know, uh, if you heard of a term called milk letdown when mom is nursing the baby, so it has part in these two. Oxytocin is secreted by the brain into the bloodstream, and it is because of the some kind of nerve cells they get activated, and that's how it is released, and it goes straight to the blood, and it causes labor contractions, and it tightens the uterus after a baby is born to deliver the placenta. So have you, as I mentioned also earlier, you must have heard of a term called milk letdown. So that's the oxytocin which is causing the milk to be released into a mother's breast to feed her baby. Now, when they say, when you go on the label and delivery floor, they said, oh, this mom is having, we're just starting oxytocin, we're just starting pitocin on this mom. Now, that is synthetic oxytocin, and it is given to the expectant moms, and it is done through an IV, intravenous, and it stimulates labor contractions, or they make the contractions more stronger. Injection of pitocin can be also given after birth to stop the postpartum hemorrhage, to stop the bleeding after the birth. Now, since oxytocin is commonly used to induce labor in pregnant women, it's very important that we keep a track of, how many contractions are happening. If there are too many contractions, then we have something called tachysystole, which can decrease the blood flow to the baby and can also cause brain damage or death. So, giving oxytocin IV for a long period of time can cause some side effects to the mom. I'm not talking about the simple side effects of nausea, vomiting, but some high level dangerous side effects like blood pressure can go up, some abnormal heart rhythms can happen, even a uterus can rupture, and or as it happens with any new thing, as allergic reaction can also happen. So oxytocin is a high alert. It needs some experience, some monitoring, some supervising. So it is taught in a separate way, in a separate section under OB Math. So let's go to the next slide. So two medications commonly used in our maternity OB Math are oxytocin and magnesium sulfate. We'll talk about each other one by one. Next, let's go to the next slide. Oxytocin, I already talked about this. The only thing on this slide, which is the sentence, is that it can be titrated up or down based on client's needs. So titration is something, if at this level of the school, if you are not familiar with this terminology, titration, I think you should look it up in your med terminology book or in the dictionary. In simple words, it is adjusting the medication on the pump, based on certain data accumulated. And this is all done strictly under some protocols. So oxytocin, MAC, both of them will be done, if they are titrated, they would be done under strict protocols. In any L&D floor I'm in America. I don't know about the foreign countries. Okay, MAC sulfate, and this is for the pregnant women who have something called high blood pressure, preeclampsia, then it will help in preventing the seizures in those mothers. And it is also used off-label to control preterm labor. And as I said, like oxytocin, this can be titrated up or down. And now this is the background information I'm giving you on two medications. This does not mean that in OB Math I'll be giving you to write a thesis on these medications. Okay, so let's go to next slide. IV administration of medications by milliunits per minute. Milli-unit is just the 1,000th part of a unit. And from now onwards, it's just conversions. The wordings of the questions would be a little different, but you keep focus on the conversions and the numbers involved. Okay, so let's go to the next slide. So it says you have been asked to run the following on an electronic pump per MD order. And this is to start a MAC sulfate bolus with 5 grams in 100 ml of normal saline given over 20 minutes. What is the IV flow rate on the pump? Now before, as I said in the red font, I will look at the units, what measurement units we have here. So we have grams, ml, and minute. And we are going, it says, what is the IV flow rate on the pump? So the flow rate on the pump would be in ml per hour. We have ml here, 100 ml. And then it has to be done in 20 minutes. Now, MAC sulfate bolus with 5 grams and 100 ml of normal saline given over 20 minutes. It's no different than what ml per hour calculation you have done before. It's just that it is asking you want the answer in ml per hour, and it is giving you data in minutes. So automatically, you have to make this minute into an hour by using the conversion, which is 60 minutes over an hour. And that's how you'll get the answer 300 ml per hour. Okay, so let's go to the next question. Again, the order is MAC sulfate, which is in 40 grams in 1000 ml of lactated ringer at a rate of 2 grams per hour. What is the IV flow rate on the pump? So we have the volume, which is 1000 ml. We have the concentration, which is 40 grams, and it is going on at 2 grams. It's supposed to go at 2 grams per hour. Now there is no minute. Your question has a data which already has hour in it, so we are not doing any conversions. It's as simple as that. You do a simple dimension analysis and you will get 50 ml per hour. Okay, so let's go to another slide. the you've been asked to add 20 units of oxytocin to 1 liter of normal saline. How many ml will you add to the bag? It's a simple dimensional analysis or ratio proportion. We got the answer as 2 ml. I don't think I need to do much of explaining in this because you have been doing this since your last semester. So it is as simple as possible. Yes, there is a oxytocin here, the bottle, the vial, and you should see that what is the concentration written on those. Now, in your math OB exam, I can give you pictures of some medication labels, and you'll have to figure it out that what is the concentration on the bottle. There can be 100 numbers on that bottle, and what number you are dealing with. So here in oxytocin, it shows you 10 units per ml. So, uh, so we are done with this question. Let's go to another question. It says oxytocin protocol at label and delivery for is to start the infusion at 1 milliunits per minute and increase the infusion by 2 milliunits per minute every 60 minutes until adequate labor is achieved. So of course, what is happening here is titration. So there's now when you go on the floor, many drugs are titrated, and there is a proper, like steps to follow. So you can say on the floor, what is the protocol for oxytocin, and this is all done in consultation with the doctors. They do it, and there is a proper form, and the form says this. It might be on a form which says that at labor and delivery flow, you start the infusion at 1 mu per minute, and then you increase it by 2 mu after an hour until adequate contraction has been achieved. So what is the IV rate on the pump? If the premix bag of oxytocin has 30 units in 500 ml uh, of, of lactated ringer. So 2 conversion factors are required. Now there's a lot of words here, a lot of numbers here. The wording, you are not familiar here, but you have to first, if you make an equation of dimensional analysis, it will help you better. So we have to get answer in ml per hour. We have, first of all, the first number we have is 1 milliunit per minute, and then you have 2 milliunit per minute. Okay, so we know for sure that we have milliunits per minute, and we have to get ml per hour. So first we will do the conversion for milliunits. So 1000 milliunits make 1 unit, and the initial order was 1 milliunit per minute. So I could have written 1 milliunit per minute first, and then I would have written 1 unit is equivalent to 1000 milliunit. Whichever way you write, it's okay, as long as you have made the equation which is leading you towards the unit of measurement you desire. So 1 unit is 1000 milliunits, and 1 milliunit per minute we were supposed to start at, and the volume of the solution is 500 ml, and it has 30 units of this drug in it, and 60 minutes per hour. We will definitely do it because we have to use a conversion. So here 2 conversions have been used to get the answer 1 ml per hour. Okay, so we start 1 milliunit per minute, and then we increase it to 2 milliunit per minute every 60 seconds until adequate labor is achieved. So the line 2 milliunit per minute every 60 minutes, this is sometimes there is information which would not lead you towards the final answer. And so the 2 milliunit per minute is something which we are not going to utilize here. In the exam, if there is a titration question, it would look somewhat similar like this. Okay. When you all have your maternity rotation, you'll see an actual Pitocin drip going on the floor, then all these protocol will make more sense to you. Right now, you are going to concentrate on the calculation. Okay, let's go to the next. Or if anybody has any question, please email me, please. Okay. Okay, next, go to the next slide. Oxytocin, order is oxytocin infusion 5 milliunits per minute. Available is 30 units and 500 ml of LR. What is the pump rate? I don't need to explain this again, because here again you have two conversions. And when you're doing conversions, I have been correcting your math papers. It is if you are not still after last August, you had your orientation. That was the first day I taught you about stacking up the numbers properly so you have a good equation, dimensional analysis equation, to get your desired unit of measurement. But if you are still not sure at this level how to stack up, there's still a couple of people. You can come to me on Fridays, afternoon, and I will explain you how to do it, because this is the most basic thing. So the drug is different drug which you're not used to earlier, but the method of calculation is same. So let's go to next slide. 20 units of oxytocin in 1000 ml of lactated ringer is infusing at 45 ml per hour. How many milliunit per minute is the patient receiving? So it got reversed. So they were asking us ml per hour earlier. Now they had given us ml per hour, and they're asking 15 milliunits per minute. So 45 ml per hour will itself become, fraction. It can become an equation in itself. When it becomes an equation itself, and you have the other two numbers, 20 units and 1000 ml per hour, then the calculations becomes easy. Now you have data in 45 ml per hour, and they're asking you to do it in mu per minute. So definitely you will use your conversion of 1000 milliunit is equals to 1 unit. So that's why we have to add extra fraction here, which is 1000 milliunits per equals to 1 unit. Otherwise, the rest of it was already given in your question. So we do 20 units over 1000 ml multiplied by 45 ml per hour multiplied by 1000 milliunits per unit. And it's and then an hour over 60 minutes, and it give you the 15 milliunit per minute. So we have actually two conversions here. Okay, so for your OB math, the kind of questions I'm giving you here, similar kind will come there. And if there are questions which are kind of looking little different than what I'm giving you, it would be different, not because it is a little higher level than these questions. It would be different because it is based on the same dimensional analysis method. Okay, and conversions, you are familiar with conversions, and here the new conversion which we have got is like 1000 milliunits is 1 unit. So that's the only new thing in this, what we have learned. Okay, so there's another. Let's go to our next slide. There's another calculation which I really wanted you all to see. You don't do IV push, maybe in the last clinical in senior year in ER and critical care you'll be doing. Now IV push, so this is just an IV push calculation, and it says that the RN enters patient's room and she notices BP to be so high and the heart rate is so much. Respiration is 16 and oxygen saturation is 95. And she calls doctor for stat order of hydralazine, because that's the quick IV medication which will help patient to bring the blood pressure down. And doctor's order reads as 5 milligram over 2 minutes stat IV push. So stat you all know, and this is simple calculation I did. So 1 ml is 20 milligram, 5 milligram will be how much. And where did I get the 1 ml over 20 milligram? I got from this bottle, which the picture is right on top. So I saw the bottle of hydralazine, and then I did my simple dimensional analysis calculation, and I got the answer as 0.25 ml. Now here the particularly wrote in words leading zero. So now you see in first exam, when you don't write leading zero, I don't give you any grade for that. So that's why it's so important. So this brings us to the end of this maternity OB math. And if you have any questions, send me to the email. Okay, thank you.